Thank you, John, Dr. Sharon, for the kind invitation and the opportunity to address you today. This really is about creating a movement. I like to say that for years now we have been attempting to approach what Malcolm Gladwell calls the tipping point, where once you cross over, there's no turning back. Like cancer, there was a point in time where it became okay to talk about it. And of course, to pour the tens of millions of dollars of research into finding cures for many cancers. And unlike 30 years ago, now we talk about it regularly. As horrible and as tragic as it is in many instances, the stigma around those sets of issues are no more. We have not yet hit our tipping point when it comes to the mental health movement, but we're coming close. And the question is whether or not together we are going to forge ahead to create a movement that will make mental health the top-tier public health priority that it must be in our country. No longer should mental health be the unaddressed and unattended to issue of our time, which it is now. So this is not about stigma, but I do think it is important to point out that, you know, if God forbid you're rushed to the hospital with a heart attack or your loved one is, there's no question that when you get to the hospital, your loved one is going to have a bed. You're rushed to the hospital or your loved one is rushed to the hospital in psychiatric crisis under so-called 5150. In too many instances, you or your loved one will languish in the hallway in a gurney of an emergency room for 20, 24, 30, and 40 hours without getting care and treatment. The stigma is still thick and exists. When you miss work for a month because of a heart condition or some other illness, you'll come back to work and you will tell your coworkers, probably without hesitation, why you missed work. You come back because you've missed a month because of bipolar illness or schizophrenia or severe depression. More times than not, you will still not tell your coworkers for fear of being looked at differently or not being seen as able to do the work or to get a promotion or whatever it is you seek in your workplace. And of course, if you were walking down the street, as many of us do every day, and saw somebody with a bloody appendage, an arm half off, God forbid, you would stop. We'd call the emergency. We'd call 911. Emergency crews would envelop that person. We have a state of homelessness in California and in this country where people with severe mental illness we see every day. And we're all guilty of it. We too often walk by, sometimes we stop, but in our busy lives, it is sort of an accepted way of California life. And then you look at homelessness as a prominent example, but you could make the same case around the criminalization of the mentally ill and our county jails. And you look at some of the statistics and you wonder why we haven't solved the problem. 50% of all mental illness begins by 14 years of age and 75% by 24 years of age. The average delay in receiving appropriate diagnosis and treatment is an astonishing 18 and a half months after the illness takes root and the patient suffers their first psychotic break. When Dr. Sharon talks about prevention and early intervention being the lead theme of the mental health movement, I could not agree more. I don't know. I'm a mayor of a large city now. And we are trying awfully hard to combat the tide of homelessness. I've committed to getting 2,000 people off the streets over the next 3 years, and it's a daunting challenge. And here in Los Angeles, you've housed tens of thousands of people But the most Pyrrhic of victories is to get people off the streets. That's a great thing, only to have them replaced by the same number or more people, another cohort of similarly homeless people. This idea that prevention and early intervention is the only answer to not continually chasing our tail ought to be self-evident. And here's what we know. Under California's Mental Health Services Act, we actually wrote a measure that in its written words actually is the vision for what a mental health system should look like. Culturally humble, recovery-based, client-centered, innovative. 20% of the money every year must be spent on prevention and early intervention. Well, what that the money is going. Okay. Well, I think we're going to have plenty of opportunities for question and answer, and I appreciate your frustration because I'm so sorry.
And there's no accountability, and there is no transparency. And my child was not the only child to die.
Too many children have died. Too many people suffer. Too many families suffer. And we come together today to build on a lot of good work, but to recognize, as you state, very, very poignantly, that we have a long, long way to go. In my remaining 12 seconds, even in California, where we devote $500 million a year now, approximately, to prevention and early intervention, we have not yet really defined what we mean by it. And we also haven't said, as a movement and as a state, with that kind of money, it is important to have a strategic sense of how to maximize the impact of that money. You know, I'd rather do 3 things really well than 50 things not so well. And so where do we focus? We need to focus on childhood trauma. Too many kids exposed to violence. We need to focus on early identification. The statistics bear it out. How many teenagers, if they got the help early, would have a much better path than what happens when we don't identify their illnesses, their family histories, their behaviors, and see this young person needs the same kind of wraparound service, family-based service, intergenerational care that we will try to give them when they're in their mid-20s and have already been through how many systems and are that much sicker. And we must intervene early, whether it's the college campus, whether it's the high school campus, whether it's immediately after the first break. This is the movement. It's to avoid tragedies, not to try to catch up after the tragedies happen. It's about preventing suffering. Mental illness does not have to be a life sentence of unemployment, disconnection, jail, the streets, suicide, and early death. We are not past that tipping point. We still, as we say oftentimes in the movement, I know use the cancer analogy, we have a stage 4 system. We intervene for the seriously mentally ill, as you say, and oftentimes too ineffectively. when somebody is so sick that recovery is always possible, but much less likely. It's time we build a movement that says we identify and we intervene at stage 0, at stage 1, and at stage 2 so that people can have better lives. This is not about the other. This is not about those people. This is about us. Why did we pass Prop 63 in California? Well, we picked a tax on millionaires. That didn't hurt, I will admit. But the real reason why we passed Prop 63 is because while the homeless may be the most visible manifestation of untreated mental illness, this is about our families. This is about our communities. This issue knows no socioeconomic boundaries. It affects communities of color in more profound and traumatic ways often, but it knows no artificial political, gender, age-based boundaries. We can be the pride of the nation if we choose to convert what we know, our conscience, into real political action here in California. The time is now. The movement has started. The movement is far from finished. Let's save more lives, because this is us. And we have an opportunity to do something great in this state and in this country, and to not forsake anyone. And that's what we do. We forsake people. We essentially say, your problem is too severe, too serious, it's too difficult, and we can't help you. No more. We know what works. Let's get it done. Thank you very much. Appreciate it.